Please mention in the chat box. So today's topic is PCOD. Today's topic is PCOD. This topic is not there in the textbook. Okay. Just as an extra class, we are taking these sessions. So PCOD, polycystic ovarian disorder. Women with PCOS, that is polycystic ovarian syndrome. Okay, there is a difference between both PCOD and PCOS. Okay. In compared to women who suffer from PCOD, uh, women who suffer from PCOS, they produce higher than normal amounts of male hormones. Okay. So PCOS is more, it requires more treatment. Okay. And it gives severe symptoms as compared to PCOD. This hormone imbalance causes them to skip menstrual periods and makes it harder for them to get pregnant. Okay. Besides, there is because of this unpredictable hormones, other hormonal conditions can also happen, just like diabetes, infertility, acne, excessive hair growth. Okay, these all are hormone related behavior. And because when one hormone is not functioning properly, it can trigger other hormone related conditions as well. Okay, and this is a fairly common disorder. Nobody knows the exact cure of it, but it is a very common disorder, especially when it comes to PCOD. It is more than common. Okay. PCOS is not that common, it is more severe, and there is no cure for it. It's a lifestyle changes have to be maintained throughout the life. Okay. PCOD is a medical condition in which the woman's ovaries produces immature or partially mature eggs in large numbers. Okay, and all these cysts are capable to produce hormones. Over time, these immature eggs and immature cysts, they remain like this. They don't disappear. Okay, they don't disappear from the ovaries. That's how the ovaries get a lot of cyst. They become cysts in the ovaries. They don't disappear. Okay. Due to this, the ovaries become large and they secrete large amount of male hormones called androgens, and that is what causes infertility, irregular menstrual cycles, hair loss, abnormal weight gain. Okay. PCOD can be controlled by diet and lifestyle modifications as well. It is easier to conceive with PCOD, okay, with lifestyle changes and treatment. Uh, there is much more chances of conceiving with PCOD as compared to PCOS. Growth of unwanted hair, acne, weight gain, pelvic pain, difficulty in getting pregnant, skin darkening, heavy menstrual bleeding, hair loss, ovarian cyst. Okay. PCOS, polycystic ovarian syndrome, is a metabolic disorder women in which the woman gets affected by hormonal imbalance in their reproductive years between 12 and 51. That is PCOS. And due to this increased level of male hormones, many times what happens, the woman will skip their menstrual periods. They will have irregular ovulation. Hard to get pregnant because you don't know when the ovulation is taking place. Okay. They get abnormal hair growth on their body and face at the same time. It can lead to heart disease, diabetes in the long term. Okay. So PCOS, it's a serious medical condition and it requires proper medical attention or surgical treatment if necessary. Okay. Many women, they have PCOD, PCOS, but they don't know about it. Okay. Because the group of symptoms that affects it affects ovulation and ovaries, ovarian cyst, increased level of male hormones, skipping of periods, irregular periods. Okay, these are seen in both PCOD and PCOS. So the difference between PCOD and PCOS, what is the difference between these two? Occurrence of PCOS is rare and lesser, but PCOD is very common. Okay, throughout the world, a lot of women suffer from PCOD. Definition of PCOS, it's an endocrine disorder of the ovaries with immature follicles. In PCOD, it is a metabolic disorder due to hormonal imbalance. When you correct the hormonal balance, the PCOD also disappears. Presence of cysts, the minimum number of cysts, more than 10 cysts is seen in one ovary. In PCOS, you have less number of cysts, but the effect is quite high. Okay, the symptoms are quite high. In PCOD, you will have more than 10 cysts in each ovary. Causes: genetics, lifestyle, eating habits, mental health. In PCOD, again, it's genetic as well, insulin resistance, inflammation, weight gain, all of this which is corrected. Genetics you can't correct, but insulin resistance, inflammation, weight gain, if these things you correct, PCOD will also get better. Severity, PCOS cannot be reversed. Okay. PCOD can be reversed with medication, with lifestyle changes. Treatment, diet control, exercise, lifestyle changes, medication. In PCOD, diet, exercise, medication, surgery, all these will lead to changes in the body. Complications, it's very hard to get pregnant with PCOS, risk of diabetes, high blood pressure, obesity, endometrial cancer. These are the risk and complications associated with PCOS. PCOD, if you get your medical treatment done, if you get the lifestyle changes done, it is easy to get pregnant with PCOD. The most common signs and symptoms of PCOD, PCOS problems in females are irregular menstruation. The medical terminology of it is oligomenorrhea. Skipped or absence of menstruation, that's what we call as amenorrhea, no menstruation. Okay. Heavy menstruation, menstrual bleeding, menorrhagia. Excessive hair growth, me, excessive hair growth on face, body, including back, belly, chest, acne on the face, chest, upper back, weight gain, hair loss from the scalp. It gets thinner and thinner and it falls out. Skin darkening in the neck, the groin area, under the breasts. Causes of PCOS. Exactly how a woman can get affected by PCOS is unknown, not known till now. However, there are some significant factors to it. Excess insulin production, too much of insulin because of obesity, inflammation, insulin resistance that have been continuing. Okay, that can increase the levels of androgen that is produced in the body. It's a male hormone, which is even in normal females, healthy females, male hormones are produced, but in a very minuscule amount. Okay, but when androgen is produced in a higher amount in female, that causes difficulty with ovulation. It will suppress ovulation. Excess androgen production. The ovaries produce abnormally high amount of androgen that can lead to acne, hirsutism. Hirsutism is the terminology used for hair growth, excessive hair growth over face and body. Low grade inflammation. It's found in a recent study that females who have PCOS have low grade inflammation always. Okay, and that is also one of the reasons why they have higher levels of androgen production in their body, which can lead to heart diseases, and it can damage the blood vessels as well, leading to heart diseases. Heredity. Women with PCOS show certain genetic correlation. It runs in the family. If a mother suffers from PCOS, high chances that the daughters may also suffer from it. Complications of PCOD or PCOS problem: abnormal uterine bleeding, infertility or hypertension, infertility, hypertension, blood pressure issues that comes with infertility. That is another reason. Type 2 diabetes, type 2 diabetes, preterm labor, and premature birth. If at all the woman gets pregnant, there are high chances that she may go into preterm labor. Metabolic syndromes, risk for high blood sugar levels, high blood pressure, heart disease, diabetes, and stroke as well. Non-alcoholic fatty liver. Steatohepatitis is fatty liver. Okay, NASH means non-alcoholic fatty liver, steatohepatitis. Depression. Many women end up experiencing depression and anxiety due to unwanted hair growth and other symptoms as well. Sleep apnea, breathing difficulty while sleeping. It's more common in women who are overweight, causes repeated pauses in breathing during night, which may interrupt their sleep as well. Endometrial cancer due to thickened uterine lining. Miscarriages, very common, spontaneous abortions, miscarriages. So diagnosis of PCOD and PCOS, pelvic examination, physically checking the pelvic region, palpations are always done to the reproductive organs to find if there is any abnormal masses or any abnormal growth. Blood test. Blood test will help to understand the hormone levels. This includes the fasting lipid profile. We check the levels of total cholesterol, high density lipoprotein, HDL levels, triglyceride levels, low density lipoprotein, glucose tolerance test. Okay, these are the tests done. Imaging test, ultrasound imaging test is done to check the size of the ovaries, the lining of the uterus, cysts in the ovaries, if at all there are any cysts present. The gynecologist might recommend an additional test to check for complications. So these are monitoring the blood pressure, glucose tolerance test, cholesterol and triglyceride levels, screening for anxiety, depression, mental health checkup, screening for obstructive sleep apnea to see the breathing pattern. Okay, they put you on a device before you go to sleep at night, and just to find out your breathing pattern, your REM, RAM, and all. Lifestyle modification and home remedies for PCOD and PCOS, maintaining a healthy body weight, limiting the carbohydrates consumption, low carb diet, do regular exercise and be active. Treatment, it focuses on managing your individual problems such as irregular periods, obesity, infertility, acne, hirsutism. All these have its symptomatic management that is done. For hirsutism and all, laser hair removal therapy that is done. For acne, again, dermatology, laser therapy, these things will happen. Skincare routines, infertility, various medicines, school of medicines are there, allopathy, homeopathy, Ayurveda, based on your choice. Obesity, weight reduction has to be done. Irregular periods, insulin resistance has to be tackled first. So usually lifestyle changes like weight loss, diet, and exercise can help a lot. Losing just 5 to 10% of your body weight can also help regulate your menstrual cycle. And treatment will depend on symptoms like hair growth, acne, metabolic disorders. You have to regulate your menstrual cycle by medication. Okay, some women will be prescribed on oral contraceptive pills as well to treat hormonal imbalances and insulin resistance. Inducing ovulation, okay, by estrogen injections. High levels of estrogen can induce ovulation. It can overcome and suppress the function of androgen. The quality and quantity of ovulation through oral medicines and injections. Infertility treatment through fertility drugs, lowering excessive hair growth through laser hair reduction therapies and all, skin treatment for acne and pigmentation. In severe cases, surgery or laparoscopic procedures will be done to drill into the ovaries and remove the tissues that have a lot of cyst. If patients don't respond to hormonal therapy and lifestyle changes, then the last option is laparoscopic procedures. Any diet that helps you to lose weight, okay? You can choose any diet, keto, or low carb diet, intermittent fasting, whatever suits you. Okay, you can use that to help with your condition. Some diets have their advantages over others. Weight loss can also improve the cholesterol levels, insulin levels, reduce heart diseases and diabetes risk as well. 20 minutes of moderate intensity exercise, at least 5 days a week, can also help women to lose weight. 5 days a week, 20 minutes, 20 to 30 minutes per day. Okay, this can help. Losing weight with exercise also improves the ovulation and insulin levels. So diet control and exercise. So the best treatment for PCOD and PCOS will consist the on-time diagnosis without getting late. Appropriate treatment modalities can also help overcome the symptoms. Symptomatic management is done. Not all the PCOD patients will suffer from hirsutism. Okay. Whoever suffers from it, symptomatic management has to be done. Maintaining a healthy lifestyle is also important. If any queries, we can mention the chat box.